Coronaviruses, SARS-CoV causes Severe Acute Respiratory Syndrome, SARS. According to the World Health Organization (WHO) trusted source, the first human cases appeared in southern China in November 2002. SARS-CoV may have originated in bats and were transmitted to other animals before infecting humans. During the 2002-2003 epidemic, more than 8,000 people in 26 countries trusted source around the world contracted SARS. There were 774 trusted source reported deaths. The outbreak was contained in mid-2003 with the implementation of infection control practices such as isolation and quarantine. Since then, a handful of cases have occurred due to laboratory accidents. There are currently no reported cases of SARS transmission in the world. However, if the virus re-emerges, it could pose a significant threat to the public. MERS-CoV causes Middle East Respiratory Syndrome, MERS. According to WHO trusted source, it emerged in September 2012 in Saudi Arabia, although initial cases were later traced back to Jordan. Humans contract MERS-CoV through contact with camels that have contracted the infection. The virus is also transmitted by coming into very close contact with a person who has the infection. Since 2012, 27 countries have reported more than 2,400 MERS cases. To date, the majority of cases have occurred in Saudi Arabia. In 2015, an outbreak in South Korea led to 186 cases trusted source and 36 deaths. According to the CDC trusted source, this outbreak originated with a traveler returning from the Middle East. According to the European Centre for Disease Prevention and Control (ECDPC), there were more than 200 cases of MERS-CoV reported in 2019. Health authorities around the world continue to monitor MERS cases. SARS-CoV causes COVID-19. This new coronavirus appeared in Wuhan, China, in late December 2019 after health officials noticed an increase in pneumonia cases with no known cause. These cases have since been linked to a market selling seafood and poultry. Though the virus likely evolved from an animal source, its exact source is unknown. Within a few months, SARS-CoV has spread to hundreds of countries around the world after being transmitted through person-to-person contact. What type of coronavirus originated in China in 2019? The virus that originated in China in 2019 is a new coronavirus that likely evolved from an animal source. It's been named SARS-CoV-2. SARS-CoV-2 causes the illness known as COVID-19. It's dangerous because it's transmitted easily trusted source from person to person, whether or not the person is exhibiting symptoms. As the virus continues to spread around the world, many countries are asking people to stay home to prevent transmission. There's currently no known vaccine or medical treatment for COVID-19. Research in these areas is ongoing.